staffing up for coronavirus cause a decline in admissions for heart attacks. After all, they're still open for emergency medical procedures like surgeries for heart attacks. And it turns out this is not limited to just this country. Investigators from Spain also reported a 40% reduction in emergency procedures for heart attacks during the last week of March compared with the period before the pandemic hit. What's going on? And it's also strokes. Decline in other emergency procedures, including appendicitis and acute gallbladder disease. Now, there are a couple of reasons. I'd be interested in what you think. 888-971-SAGE. One of them is just people are just suffering at home and just toughing it out. Maybe people are afraid to come to hospitals because they fear that they're more likely to contract coronavirus there. Doctors from Hong Kong report an increase in patients coming to the hospital late in the course of their heart attack, which means that the treatment is going to be less likely to be effective. So the doctors are not urging people with severe illnesses, heart attacks, strokes, to not come to the ER for crying out loud. They're just not doing it. Another possible explanation, however, is this. In this era of social distancing, maybe we're having fewer interactions that cause anxiety and stress. Maybe we're not engaging in the same kind of excessive eating or the kind of on again, off again kind of exercising that a lot of people engage in that often causes problems. But I'd be interested in your thoughts on this. This Yale doctor says he doesn't know. Didn't expect it. Surprised. So we've canceled elective procedures, okay. And we're now doing care at home through telemedicine, okay. But these are for stable outpatients, not for those who are acutely ill. Why would people suddenly be less likely to come to the ER when they're having a heart attack? Unless they're having fewer heart attacks. And what would cause that? We're in a time of high anxiety. People are concerned about their finances, obviously. Millions of people out of work. I drive to and from work on empty streets in an empty building. I am a news person, so the order at stay at home does not apply to me. So why would heart attacks, admissions for heart attacks, admissions for strokes be down? And not down by a little, down dramatically. Maybe, just maybe, staying at home, not interacting, not having to drive and battle traffic each way, maybe the stress from interacting with people at work, I don't know. But this doctor is shocked, surprised, didn't expect that, didn't anticipate that. Says at times of stress, the risk of heart attacks and strokes typically go up. Depression, anxiety, frustration, quote, feelings that the pandemic might exacerbate are all associated generally with a doubling or more of heart attack risks. Work, life, stress. These are kinds of things that generally cause admissions for heart attacks and strokes to go up. Instead, we're seeing the opposite. And he says, we don't know why. Quote, we actually expected to see more heart attacks during this time, end of quote.